News Talk 100.3.
And on Live Talk, we now have with us Dr. Shiva. She's the first female surgeon to be accredited as a master surgeon in the multidisciplinary endometriosis care in the Middle East, and also globally the third person to be accredited for the same. Hi, Dr. Shiva. Very pleased to have you on the show.
Yeah, very good to see you in the morning.
How are you doing?
I'm fine.
Okay, so great. So, just if you can tell us a little bit about yourself. How long have you been in Dubai, and where are you from originally?
Yeah, I'm originally from Kerala, the God's own country.
Oh yes, absolutely.
Okay. And I'm here for the past 26 years. It's like my second home.
Amazing.
Yeah.
Right.
I've been working with various hospitals which are in the private sector, and right now I am with a Medcare Women and Children Hospital.
All right. Okay, great. This the one at
The Sheikh Zayed.
Zayed Road.
Yeah.
Okay. All right. So you specialize in endometriosis. There isn't much awareness about that. So if you can just tell us what exactly it is.
Yeah, endometriosis is actually, it is a chronic debilitating disease which can affect the female and which can pose a significant toll on the quality of life.
Okay.
So it's really, the incidence is very high, and what it is the lining of the uterus, the tissues similar to the lining of the uterus is seen outside the uterus. So it can cause, very severe pain, especially during the periods. And also it can potentially cause, the fertility issues.
Okay. And how common is it?
Yeah, it is it's common. Actually, it affects 5 to 10% of women worldwide, and in UK it is estimated as 1.5 million. It's similar to diabetes mellitus. So it is a very significant healthcare issue.
Okay. Do you think because there is less awareness about it, women come to you when it's too late?
Yes, the awareness among the lay people as well as the healthcare providers also, generalist healthcare providers also is not that great, but it's getting better nowadays.
So you mean a regular MBBS wouldn't?
Yeah, now the awareness is getting much better because of the education and the continued medical education. But the average time from the diagnosis to from the symptoms to the diagnosis, it ranges around 7 to 8 years. It's a big time frame. Because this can be attributed, sometimes, this is cultural belief among the patients as well as their family that the pain during period is very normal. Mm-hmm. So they think that it's normal.
They normalize it.
Yeah, normalize it. They will not think it's a pathological pain,
Yep.
The pain, they have to differentiate between the normal pain during periods and the pathological pain which is in endometriosis. The pain will come almost a week before the period starts, and the pain will continue even throughout the period, and it can even last after the period also.
All right.
So that is not normal.
Okay. So what are the symptoms really?
Symptoms, it's a complex condition, and it's with varied symptoms. So it can range from pelvic pain in the during periods, as well as it can be cyclical, or it can come at any time in the pelvic region. Then the period pain during periods, the pain that's called dysmenorrhea, and during and after having intercourse. And bowel symptoms like constipation and altered bowel symptoms like diarrhea and constipation. And then you can be fatigued. So it is a wide range of symptoms.
It can start before, during, and remain after the periods.
It can remain. And even while during periods, while passing urine and passing stools also, and rectal pain, all these things can happen.
Okay.
So these are all not normal. So this
Correct.
is high. We need to educate from the teenage onwards, from
Correct.
the school itself it has to
So
start.
what kind of challenges do you see? Because I think if women are not aware about this, they would usually just take painkillers and go on with their lives.
Yes, that's exactly. There is a lot of medical wandering also, because patients will go and they talk to the doctors also, general doctors. They will also think it is normal. Even their family think, and even the patient patient themselves, they think it's normal. So they
Right.
keep on, taking the pills and painkillers and that go on.
But why does it happen?
The endometriosis, as I told you, though, the lining of the uterus, it can
No, but is there any reason?
reason,
Like any?
the reason, actually, it is a pathophysiology or the etiology or the cause is really very unclear.
Oh,
But definitely lot of things are there, that the main one of the main factors is the genetics. If family mother or sister is having a endometriosis, then the lady has more chance of endometriosis. Doesn't mean that every time a family history is there, that lady has to get it. Not like that, but the family
Okay.
history plays a role.
But can it be prevented?
It is very difficult because we don't know the cause. If you know the cause, we can prevent
treat
it.
it,
But definitely these symptoms, patients have to, when they have this concerning symptoms, they have to approach the healthcare providers, and definitely we have to have the diagnosis.
All right, we'll continue talking about this. Very interesting because there is less awareness. Right, it's 12:12 and we still have Dr. Shiva with us. She is a world-renowned specialist for endometriosis. We're talking about this condition because it has very little awareness, but it's also quite debilitating, as we have established already. Now, doctor, one of the things that I feel is very problematic with endometriosis is because women don't talk about it. Also, the men in their lives also don't know much about it because they're just silently going through this pain. And it has also been called a silent pandemic, right? If I'm not wrong.
Yes, yeah. It is called a silent pandemic because the patients and the family, they are not ready to address it, because of the cultural limitations, as well as, they think it is very personal.
But when do you think a woman should go to a doctor, especially for this? When will she know that she has any sort of onset of endometriosis?
As we discussed, the different symptoms which we already mentioned, any of these concerning symptoms, if they have, then definitely they have to go to a healthcare provider and directly, or you can be referred, from the general gynecologist or general GP practitioner.
Right.
They can be referred to the specialist who is having an interest in endometriosis.
And at what age typically do you see this?
It can range from teenager till menopause because it's an estrogen dependent condition. So estrogen or female hormone dependent condition. So it can go up to menopause. So even though mostly we see from 30 to 40 years, the maximum number of patients is in the reproductive age group between 30 and 40 years.
Okay. But is it ever fatal?
No, it is not fatal. It is a benign condition. It is not a cancerous condition, but it is a very debilitating, challenging, complex condition.
Okay, so while we were talking, I messaged my friend in India. She has been complaining about these kind of pains, and she is suffering from a chronic endometriosis, and she says that she just came back from her test, and it seems she's formed cysts now because of that. And she might have to go through a surgical procedure as well. So what are the kind of complications that we're looking at because of endometriosis?
Yeah, endometriosis is a very complex and different phenotypes are there. It can affect the ovaries alone. It can affect any organ. Like it can affect the bowel. It can affect the urinary bladder. It can affect even the lungs. It's so varied. Symptoms can come, and depending on the where it is affected, the complications can also come. For example, your friend is having a cyst in the ovary, and we have to make sure all the cyst may not be endometriotic cyst.
Okay.
Endometriotic cyst is usually called chocolate cyst because it contains the altered blood. So it's called chocolate cyst. It looks very nice. Chocolate means, it looks very sweet.
Yeah.
But it's not sweet. It's a very challenging, very difficult and complex condition to deal with.
All right. Okay. We're also getting messages from our listeners asking for your details. So why don't you also tell us where to find you and how to get your appointment?
Oh, okay. I am a senior consultant in Obs and Gynae, working right now at Medcare Women and Children Hospital, Sheikh Zayed Hospital, Sheikh Zayed Road.
And the appointments can be booked online?
Appointments can be booked online, and
Okay,
Can-
on the
yeah.
website of Medcare.
Yeah, and also you can go. You can see my website, Dr. shivahk.com.
Okay, Dr. Shiva.
drshivahk.com. You can see, and then you will get the number for getting my appointments.
All right, great. And also, just before we let you go, since there is less awareness about it, do you think more is being done to spread awareness? I think you are doing some great work in this field.
Yes, I'm very happy that because I was a general laparoscopic surgeon before 5 years, but when I came to know how women are suffering, because of this debilitating condition, I really want to put some effort, and I have done a lot of hard work and commitment to gain experience in this advanced laparoscopy to deal with this complex condition. And we are doing very good work, surgical work, as well as the awareness. We have made a lot of leaflets, brochures, and those who are having pelvic pain or the chronic pelvic pain, we give a questionnaire to answer, so that we can pick up the cases of the endometriosis.
Okay.
Yeah.
All right. My friend just messaged because
Yeah.
she's listening right now
No
to
problem.
us, because I told her, she said she has the chocolate cyst, and that's what exactly you
Yes.
said.
Yeah. So what is the size of the cyst? Depending upon that, and her what is her concern, like whether it is infertility or she's having pain. Depends. It has to be, the treatment has to be individualized, and
On
it has
that.
to be targeted according to her concerns.
And is it always surgery, or is it?
No, there is medical treatment also. Not that surgery is one of the modalities, but there are indications and criteria for selecting the patients for surgical approach. But usually we start with medical treatment mostly, and if the cyst is very big, and if the symptoms are more, and if it is some criteria is there for surgical intervention, then we will go for surgery. Otherwise, we will try for other modalities like medical treatment.
All right. Thank you so much, Dr. Shiva. That was really insightful. And I think more awareness needs to be spread for conditions like these, and especially because women don't talk about this. And also men also have to be educated, sensitized about it, so that they can help women in their families and their lives.
100% correct. The men has to be more sensitive, and they have to understand, this pain during periods is not like very normal.
It's not a taboo.
Sometimes,
It needs to be spoken
it's
about.
not a taboo, and they have to be upfront with their symptoms. And if they have any concerning symptoms, they have to come up and address their issues with the healthcare providers and with the family as well.
All right. Thank you so much, Doctor.
Thank you so much.